Hello, welcome back. So now we're having a little chat about root canals. So a lot of us have heard it's one of the most feared things that exists next to sharks and alligators, root canals. So what causes a tooth to need a root canal? Very good question. So initially it's something that causes a tooth become infected. And that can be from a trauma to a tooth. You fell off a bicycle and hit your tooth hard. It can be from a cavity in a tooth that got so deep the bacteria caused it to die. Different things like that can cause it. And so how do you know when you need a root canal? There's different ways. Usually the key things are signs of infection. So you could get a swollen pus bubble next to a tooth. Very definitive. Or a lot of pain. And we're not talking it's just sensitive when you drink water a little bit. We're talking when you drink hot coffee and it puts you on your knees for 5 minutes. Really bad pain of that nature. Or you're simply watching your favorite TV show at night, relaxing, and you get wicked, constant, sharp stabbing pain. Although you're not eating or drinking or anything, you're just relaxing. And this feels like a knife stabbing your face every 3 seconds, and it will not go away, no matter what you do. So swelling, spontaneous stabbing pain, or extreme reactions to hot or cold is when to get checked out for root canal. So then you come to the dentist, we do an examination, do an X-ray, do some tests on the tooth, try to figure out what's going on in there, see if it's time, see if the tooth is infected or dead or needs a root canal treatment. So what's a root canal treatment? Well, it's the method to save the tooth. So once it becomes in that phase, you have one of two choices. One, get rid of the tooth, pull the tooth out. Two is keep the teeth around by doing a root canal. So a root canal is where we go into the tooth, clean out anything that should not be in there, decay, bacteria, and sanitize or sterilize the canals. And then we clean it up. In essence, we fill it in with a specialized filling material to seal it. That way the bacteria don't come back inside your tooth. And then in the end we do a filling and something so you can chew better on your tooth. Sometimes a crown as well is necessary. And so that's the ins and outs of a root canal.